Project Officer for the SuCCEED study group. Supporting children with complex feeding difficulties is a study looking at feeding services, what we currently know and what we're doing, what parents and clinicians would like, and how we can make the services more effective. It's putting feeding on the map, which it's not on there at the moment, because currently there's nothing out there on feeding clinic services, what they should look like, how they're operating. There's a lack of awareness of feeding difficulties. There's a lack of knowledge of the services. Parents don't necessarily have an outlet to be able to contribute their input. It matters so much to us as clinicians, and finally we can actually work together with parents in order to achieve these outcomes.
The SuCCEED study is born out of a unique collaboration between parents, clinicians, researchers around Sydney. To the best of our knowledge, there's never been a study like this done in Australia, where we really look at what do parents want, what do clinicians find valuable, and put into a research framework so we can share and communicate those findings to other places and improve our practice locally. This collaboration involves 4 major feeding clinics in Sydney: Liverpool Hospital, Sydney Children's Hospital, Randwick, St George Hospital and Cogra Diagnostic and Assessment Service.
We're all clinicians working in an area that are so passionate about what we do.
And researchers from the University of New South Wales, University of Technology Sydney and Western Sydney University. And we're funded by a new research collaborative, the Sydney Partnership for Health, Education, Research and Enterprise, or SPHERE. We're a pilot project, so we're looking to do a lot of different things and see how well they work.
The questions we hope to answer in the SuCCEED study have been comprised around 4 elements. Firstly, models of care of the feeding clinic services. Secondly, what parents and clinicians value about the services. Thirdly, looking at levels of stress of parents and carers of children with feeding difficulties. And finally, development of an education package.
So I'm really excited that 3 of the 4 elements of this study are all to do with patients and families.
What makes this study unique is that parents' voices will be heard, and there is a huge focus in this study on parents' perspectives, what's important to parents, and equally with what's important to clinicians and bringing that together. We're so excited about what this is going to contribute.
So we're going to have academically rigorous research on what matters to people, a new way of helping families understand tube feeding. We collect data on what we're already doing, how many people we see, where they come from, if there's anyone we're not seeing but should be. We've got a website, childfeeding.org, where we can share our findings with people even if they can't access academic journals. And we've built a group of clinicians, parents and researchers who are really passionate about the area. And to me, I think that's the biggest step for us. We've never had the resources to bring everyone together. And I'm really hopeful that we'll be able to expand that group into the future so that we have other clinics join us as well and become a really powerful force to advocate for our families, provide excellent care for them, to collect data, and to hopefully make a huge impact onto the way children with complex feeding difficulties experience their care and their families as well.
And the opportunity to be able to marry together the parents, the clinicians and researchers is an amazing opportunity.